And I just want to say that I work with a team for ECHO in Colorado, and we all joined together to do the ECHO project for long-term care facilities. It is an incredible honor. So I'm going to be talking about, next slide, please, the global conversations with long-term staff about the COVID-19 vaccine. And I think it's really important to begin by setting the stage. You want to meet people where they are. You want to come to the conversation from a place of respect, honor, that values frontline staff. These are the staff who have worked through COVID-19 with their patients with unbelievable loss. They have put their lives on the line. And I think we need to appreciate that. And then if you're going to talk with staff for more than one time, it's a great opportunity to listen first and give people a voice. Next slide, please. And then we want to frame the conversation towards vaccine confidence. And that's really important. So the first thing that I do is to remind everybody that this is what we have been waiting for. This is how we save our own life and the life of everyone we care about. And this is how we save and help the stop of spread of COVID-19 in our community. I also remind the staff that for the first time in the history of the United States, long-term care staff is first. They've put their lives on the line, sometimes without enough PPE, and we get saved first, and that's right. And then you want to address questions. Concerns during the COVID-19 pandemic are understandable, and you want to listen and respond with compassion, answer questions honestly and transparently. Next slide, please. And then the second prong to COVID-19 confidence education is to give some facts, which we've really already heard from Dr. Woodcock. But this is a really important, tangible thing that staff is looking for. They want to know how many people were in the trial and what is the efficacy and what is my risk of getting COVID-19 if I get the vaccine. They're also incredibly concerned about severe side effects and any side effects. It's important to be honest and transparent. Next slide, please. And then the third prong is to answer the most common questions that we hear. So I have done over 30 in-services with frontline staff, and these are the most common questions that I've heard in my research in nursing homes. And these questions are available on the AMDA, the Society for Post-Acute and Long-Term Care Medicine website as part of the COVID-19 vaccine toolkit, which is really useful. And we really want to address these concerns. Some of our staff will not feel comfortable asking questions, and so we want to provide this really valuable information right up front. Next slide, please. Leaving room for questions is really imperative, giving an open forum so people feel like there's a conversation and their views are welcomed. Next slide, please. And then telling your own vaccine story. This is really imperative, and it can be very compelling for our staff and anybody you really talk to, deciding how you made your decision to get the COVID-19 vaccine. I often talk about the feeling that I look forward to having for the first time after my second dose of the vaccine, walking in the door of my home and no longer being a risk to my family. I cannot imagine how that's going to feel. And then lead by doing, discussing with staff and family your decision to get the vaccine, and talk about your experience after immunized, something that we've talked about already on this conversation. Next slide, please. I just want to highlight some of the toolkits available to having these conversations and making them incredibly productive and effective. So AMDA, the Society for Post-Acute and Long-Term Care Medicine, has a great toolkit. The CDC has a COVID-19 vaccination communication toolkit, and ACA, the American Healthcare Association, has a great toolkit and checklist that's really helpful. Next slide, please. I also want to review some of these 8 principles that to increase trust and acceptance of the COVID-19 vaccine. This is a really busy slide that I know you'll have access to after this webinar. And then there is a citation at the bottom so you can read more about these 8 principles. But I'm going to go over a few of them. So Finding common ground between what you hope to achieve and what matters to the people you're talking to and what they value is a really effective strategy for doing COVID-19 vaccine education. And use timing to your advantage. People are most likely to trust the first version that they hear. Using a trusted messenger, not only for leaders in your nursing home, but maybe there's a nurse or a CNA that's really excited to get the vaccine. CNA to CNA conversations, nurse to nurse conversations, these are highly effective mechanisms for education. And then making content concrete, providing value. And this is something we've already talked about. Recognizing that differences in communities have different relationships with vaccination, that's imperative to acknowledge that and talk about that. And reinforcing positive behaviors. Activated trusted influencers. If you have an influencer in your facility and they're excited to get the vaccine, have them help in that education. Evoking the right emotions is imperative. We know that fear immobilizes people and shame is ineffective. We want to present a positive attributes for getting the vaccine, for vaccine confidence, to helping yourself, your colleagues, your patients, and your community. And then be explicit and transparent about motivations. I always tell my staff that I'm not only invested in the residents in our nursing home, but in their health as well. And that's really meaningful. Next slide, please. And then to end with some strategies for facilities to prepare for the COVID-19 vaccine. The American Healthcare Association, AHCA, has a vaccine clinic checklist, which is very useful. I encourage you all to take a look at it. In terms of the logistics, having the largest room in your facility can be very useful with good ventilation. Everybody needs to wear a mask and stay 6 feet apart. And you really want to have 3 areas: a check-in area, a vaccination area, and an observation area. And it's important to not fill the room. We don't want 40 people waiting for their vaccine here. We want about 8 to 10 people at the most in this room. And you can have residents or staff members kind of waiting in other areas or in their rooms, and then bring 2 or 3 people to the vaccination room. And then we also want to plan for residents who will need to be vaccinated in their rooms. In terms of consent, this is a moving target right now. And so really for an emergency use authorization, we're obligated to share that information sheet, but written consent is not needed. But with our residents who do not have capacity to give consent, then we want to talk to their MDPOAs, their guardians, whoever the responsible party is. And it looks like now, if we get a verbal consent or an email consent, we can put that in the medical record, and that should be sufficient for that resident to get the COVID-19 vaccine. But I think that Walgreens and CVS are still working out some of the details in consent in nursing homes. And that's the end of my presentation. Thank you so much.